Hi there. Hey, everybody. Good evening, good evening, good evening. There you are, Melissa. Hey, everyone.
Hi, nice to see you.
Nice to see you as well. Thank you for joining us.
My pleasure. I'm excited to talk today to everybody.
Yeah, so everybody, I am so glad you guys are joining us. I have Melissa Mora on with us again today. Hopefully, you caught our last live together where we were talking about behaviors. And tonight we're going to be talking about behaviors again. But tonight we are going to be talking about behaviors as it relates to autism behaviors and IEPs. So that cross section between the three of them. And I'm so glad that you guys are here. And I hope that if you have questions, related to the topic, that you will stay on and shoot your questions in the comments. All you first timers, welcome, welcome to my live. I'm so glad you guys are here. Thank you, thank you. So hopefully you guys know who I am. I am Dr. Dannette Taylor, and I am a family advocate, and I support families of children with various disabilities, but my specialty, which is close to my heart, is for parents of children with autism. Um, and so, as a part of the services that I provide, in addition to special education services, I'm also a parent coach, and I help parents on that journey as it relates to finding peace on the journey and helping their children get to a life of independence. And so, tonight, we're not going to hold you any longer, but we're going to get started on our topic. And Melissa, can you open up by talking about um, well, how should I say this? So why do behaviors happen? Let's talk about why behaviors actually happen.
Perfect, perfect. So, hi, you guys. I'm Melissa, behavior analyst of 9 years. And so let's get right into it. So, behaviors happen.
Well, wait,
The reason why.
Melissa, wait. I want them to know the name of your company and all that good stuff about you. So yes, please do share. Yes.
Okay, sorry. So I'm Melissa, behavior analyst of 9 years, like I said. I've recently launched my business, BX Consultations, which specializes in educating parents with children with autism and related disabilities, for them to educate themselves on all the ABA strategies, and also with consultative services as well. I really wanted to make sure that parents have options and not just have it just one way, right? We want to make sure that parents are empowered and they learn everything they can learn about what they can do to help their child. So that's basically BX Consultations, in a nutshell. But yes, so I specialize in behaviors, and behaviors basically is our children um, getting something that they want or something that they need. This is information for us, right? A tantrum is a behavior. This is information. Our job is to understand why our children are having tantrums or other behaviors, right? So it's a way of I look at it as they're communicating to us, look, this is what I need, this is what I want, right? So that's basically what it is. Our job is to understand why a behavior is happening, right? Like, let's just say if they're hitting themselves or if they're engaging in something that's not pleasant, we should try to understand it so that we could learn how to help our children and replace it, right, with something more positive, more functional.
Exactly. And so you said a statement there. You said, what do those behaviors mean? And so I definitely want to piggyback off of what you said. Obviously, it's a form of communication. Um, but in my experience, I've also noticed that it can also be a way to regulate. Do you agree with that? To help them regulate their emotions?
Yeah, it's something that they need. So
Right.
if need a regulation, so a lot of self-stimulatory behaviors, the name says itself, self-stimulatory, it makes them feel good, right? It helps them regulate their nervous system. So it could be, so that is a way of them getting what they need and what they want. within themselves. So definitely understanding that, so if a child needs to self-regulate, should we intervene with that? That's a different topic, but but that's why we have to understand it, because what if we're doing more harm than good, right? So we have to really understand what these behaviors are meaning, so that we could implement the best type of strategy and support our children with what exactly it is that they're needing at the time.
Absolutely. So I've had people ask me different questions about behaviors. And one of the things that I have had teachers, when I worked in the school system, ask me about was how do they know when someone is about to have a behavior? So what type of common triggers they are? And obviously I know it's going to be unique to each individual child, but are there some common triggers that parents, or matter of fact, we're talking about IEPs, so not even parents, but teachers, educators can look out for it. And if parents aren't aware, parents can look out for it as well.
Yeah, absolutely. So we need to understand why behaviors are happening, right? So whether it's in the home or in the school. So if it's in the school, we also, parents and teachers both, need to communicate so they could understand, like, hey, these are the triggers. Like, if you're going to give my kiddo an assignment or something where he needs to sit still, that might be a trigger, right? But think about it, Dannette. So if parents really know why their kids are doing something, they could give this information to the teachers, and they could be prepared, and they could know, hey, Mrs. So and so, like, my kiddo, once you give them this, they're gonna act this way. Let's prevent that, and let's support that transition, right? What if certain sounds are upsetting them, right? If a parent knows this, it's so important to give that information to the teacher, because then they could do something about it, right? So every trigger is different, but definitely common ones are loud noises, other students around making really loud noises, teachers, having, certain tasks given. It might feel very overwhelming for a student. So these are really important things for parents to understand, so that they could, tell the teachers and other service providers, like, hey, my child doesn't do good with this. What are we going to do about this? And that ties in with IEPs and coordination of care with teachers.
Right, right. So things like transitions, like you said, demands,
Transitions are
communication,
a big one. I'm glad you said that. Transition.
um, and even sensory overload. So it really can be anything, pretty much, right?
Anything.
It just depends on the child.
It
Okay,
depends
it's
on
just a
the
matter
child.
of identifying what those triggers are. Okay, okay. And something I want to say to parents, like, behaviors get a bad rap. We immediately see behaviors and we're like, oh, that's bad behaviors.
Mm-hmm.
But it's essentially just an unmet need, is all it is. And so I want to remind parents that, when your children have these behaviors, recognize it's not just a behavior just to be having a behavior, it's a need that is currently unmet. And I also want to say that for people that don't have children with autism or children with behaviors, when you see behaviors, look at it from a framing of, okay, this child is not just behaving badly.
Mm-hmm.
It's a matter of this child needs something, needs to communicate something, is feeling something, but can't communicate it in the way they would like. So they're using those behaviors as a way to communicate. And essentially, sometimes it works out, sometimes it doesn't, right? Especially in the school setting. Because I can tell you this as a former educator and spending 17 years in a public school system. Lots of behaviors, despite having autism, lots of behaviors were just viewed as bad
Yeah.
behaviors.
Yeah.
No context to it, no understanding, but just bad behaviors. And I want parents to normalize the fact that it's not about their parenting. That's not necessarily what it is. It's the fact that your child is at school. And I'll tell you something else too. I have a lot of parents that tell me, my child doesn't do this at home. right? And so the school is constantly calling them and saying, oh, your child is behaving a certain way. Not that your child has an unmet need, not that your child is having difficulties with transitions, not that your child is on sensory overload, not that your child is dysregulated, but your child is fill in the blank and basically he's a naughty boy or a naughty girl.
Mm-hmm.
And parents sometimes feel the guilt in around those behaviors at school. They're embarrassed. They really don't want the teachers to be having a hard time, and nobody does. But at the end of the day, you have to realize that if your child is having those behaviors at school, there's a need that is not being met at school. Okay, so we've got to figure out why. So let's talk about why these behaviors show up at school a little bit more. And you and I can both talk about this because you've been in tons of school, as I. But I think one of the biggest things is an inconsistency in supports, as well as an inconsistency in expectations as well at school, especially for those on the spectrum who thrive off of routine, who
Mm-hmm.
thrives off of knowing what's going to happen next, what's familiar to them. And so a lot of times when you have people that, one, and I'll say this, especially people with poor classroom management,
Mm-hmm.
and they don't have a structure in their classroom, that tends to be a problem for kids like ours because they need that routine, they need that structure, they need to be able to expect that certain things are going to happen at a certain time. Um, Anything that you can think of too, Melissa?
Yeah, absolutely. And you hit it on the nail. Exactly. And sometimes we see this at home, they're okay, and then at school, and it could be for those reasons. Like at home, maybe parents know exactly what they need, and they have a good handle on those behaviors. They learn the strategy, but then there's a disconnect at school. Again, they're not communicating, right? Another thing that we have to understand is even if the teachers are implementing strategies, which, let's face it, they might not be able to handle as many children, we have to take into consideration that there are other students there and they're also triggers too.
Yes.
So parents shouldn't really feel bad because at home, we could tell like sibling, like, hey, don't do that or don't do this or lower your voice. At school, you guys, there are other kiddos that could be engaging. And I've seen this before. When another kiddo has a behavior, it might trigger your child into certain behaviors. So, and that's why it's important um, to have that extra support. And that's when we ask for the extra support, the aides, right? All hands on deck, basically. But I wanted to go back to what you said about it means something and it's them communicating. I always give this example to parents and I always tell them, I was like, okay, you're communicating nice right now. If someone were to tape your mouth or you wouldn't be able to speak for a whole day, how frustrated would you get? You
Right.
Me, I would probably throw this notepad and throw it to somebody to get their attention, right? So it's that communication piece, right? So it's maybe the teachers aren't really listening, right? And by listening, I mean looking at the child's behavior, see what they need, because there's so many other kids involved, right?
Right.
So I think this kind of transitions nicely into why it's important to have an IEP and why it's important to ask for the resources that our kiddos need so that they could be listened to and understood.
Before we go further, I want to address a question that came through the chat. It says, unfortunately, many teachers think that autism behaviors are the result of poor parenting. How do I deal with this? Do you want to answer or do you want me to go first?
You could go ahead and go first and I'll chime in if needed.
So first I'm going to tell you the unfortunate thing first, and then I will tell you how to deal with it. The unfortunate thing is, despite working in the school system, there are many teachers who are good teachers. Trust me, teachers, I'm a big fan of teachers. I'm a former educator. And I will say this, there are many educators who have not received the proper training for kids with autism, okay? Many teachers, they have a degree in something other than autism or special education. And even when you have a special education degree and you've learned about autism, think about how things have changed over the years and how we view autism and how we address autism behaviors, right? So I want to say that one, it depends on the teacher and how much they really know about autism, because their view and their perception of autism will dictate how they address the behaviors and how they view you as a parent. Now, as far as how do you deal with them, now this is just me talking, and I'm not going to tell you to follow me. Maybe Melissa has better advice for you, but I think that's a them problem and not a you problem. You just need to educate them as much as you possibly can about your child's disability. I'm big on bringing the BCBA, especially if you have a private BCBA, bring them to the meeting, because they do an amazing job of describing your child's behaviors, why those behaviors happen, and what they can do to support those behaviors. So, Melissa, you're free to chime in on anything there.
You said the perfect thing. That's a them problem. It really is, because these are just judgments, right? These are just judgments. And ultimately, a lot of parents face a lot of judgments, especially with their kiddos, and how they're parenting, how should we all as parents, get all kinds of judgments, but that shouldn't take away from what we know is right for our child, right? And I'm going to keep going back to this is speak to your teachers, to the principal, to everybody, and say, hey, this is the way my child works, and this is, because if we pay attention too much to what they're saying or how they're making us, feel, that could reduce our confidence as a parent, and as knowing what we're supposed to do, that could reduce our confidence, and we don't need any of that. That's the last thing that we need. So we really want to make sure that we stay strong, and it doesn't matter what they're saying. We let them know what we know about our child, right?
Yeah.
And what's work for us. And if we don't have those proper words, that's when, like you said, you bring in the BCBA and be like, hey, I don't know how to explain it in behavioral terms, you guys, but I know my child, and I know that, the team at home is doing a good job, or and they're going to explain it to you best. But yeah, I agree with you on that one.
Mari Leona, she said, I strongly believe that the teachers should be trained on how to teach and manage situations with children with autism. And I 100% agree. I don't know what the problem is with our system, why we don't do that, especially with the numbers that we have for kids being diagnosed with autism. It's shameful. It's shameful on our education system. Yeah.
Something that, we all could start, voicing this, and, little by little, numbers speak, but definitely talking to our teachers and like I said, talk to the principal, be like, hey, is there education for these teachers? If, more and more parents, we speak out, and we say what we need, that is how it's going to come about, right? So a lot of times people say, oh, one person's not going to make a difference. They absolutely can make a difference. So little by little, getting more education out there, right?
Yeah. Okay, where were we? I'm sorry, I took us kind of off path for a minute. So how can a BCBA help behaviors at school?
So that's a good question. So so it depends. So some schools have a BCBA, right? And some don't. So if they don't, you could definitely speak to your ABA team that you have on your own, the home ABA team that you have. And if you don't have one, you might want to look for one either through your insurance or your primary care physician. They can refer you to that. But definitely what we do as a behavior analyst is we look at behavior, and we try to understand why it's happening, right? So this is important, like I said, because in the IEP, in the meeting, you could ask for a functional behavior assessment. So the IEP, as you know, it's comprised of all different goals in all areas of your child. If your child is having behaviors at school, it is very recommended to ask for a functional behavior assessment, also known as FBA. This is going to make sure that your child is being appropriately assessed in the school environment. Whether they've had an FBA in home, you want to make sure that they have it in the school, right? Because it looks different in the school. They're going to place goals, right? And they're going to have, what's very important is a behavior intervention plan. This is what I'm talking about when we know what's going on, and then we could address it with the proper preventative strategies, which I absolutely love, and consequence strategies. So you guys want to ask for an FBA, functional behavior assessment, and included is a behavior intervention plan where it says what behaviors are happening, when they're happening, why they're happening, and how often they're happening. Okay, you guys. And in this behavior plan, it shows, like I said, when and why and how many times. They should be taking data on this. Why? Because if you guys don't know where your child started, how are you know if their intervention has worked? What if they're saying, hey, we're implementing these strategies in the BIP, don't worry, parent. And then you ask for the data and they don't have any. How? Or they're still having behaviors. Well, you guys, if you guys implemented the BIP, it should have reduced, Johnny hitting himself. If it hasn't reduced Johnny from hitting himself, that means you're either one of two things. It didn't work and you need to do another one, or you're not implementing it, right? So,
Right.
yeah, so we really want to make sure that they take data and something's happening. Something has to happen, right? Like it has to be reducing. If it's not working, a big part of behavior analysis is if it's not working, we need to modify it, right?
Right. Right. And I want to say this because I've been in quite a few IEP meetings where um, not a BCBA, but a behavior specialist has come into the meeting and they have brought this FBA data, and there is no antecedent to the data that they bring in.
Mm.
And so I'm like, well, if you're going to tell me what the behavior was, you're going to sit here and tell these parents all these behaviors that happened over a 10-day period from, the time they walked into the building to the time that they left. Why aren't you telling them what happened just before the behaviors? And how do you identify how to address it if you don't know what the antecedent to the behavior is? And then the flip side of that was they never discussed what the consequence to the behavior was. So what the intervention is that they're going to use for the behavior. And as a result, so Johnny threw, his shoe at someone. Well, what happened before, and then what did you do after? And did
Yeah.
that work? Whatever you did that work when you did it? So just make sure that those FBAs, those functional behavior assessments, have, especially if you're in a school setting, what they call ABC data: antecedent, behavior, consequence data. And Melissa's 100% right. From a school standpoint, there should always be data. All of these meetings that sometimes parents are telling me they have, where they're being told, well, I think and I feel, well, that's fine what you think and what you feel, but how about you just show us the data?
They,
Because
they love taking data. They take data on when your child misses. They take data on, their certain goals on those tests. They should be taking data on the
that's
behavior.
right. Right, right, right. And so I think that, that's one of the things that don't happen often enough. And a lot of decisions are being made around children's behaviors. Suspensions are happening, changes of placement is happening, all kind of stuff is happening around the child's behaviors, but no one is talking about, okay, what happened before it, so what caused the behavior, and then what was the intervention after. And also trying interventions for a period of time. You can't try an intervention for 2 days and be like, oh, well, we tried this and that certainly didn't work. Well, how long did you do it? Well, we've been doing it for 2 whole days. No, that's not enough time
Yeah.
to see whether or not an intervention actually works. Yeah.
I agree with you 100%. And it could be as simple as like if they're having issues with transitioning, it could be as we could prevent a lot of behaviors. We could prevent them. If
Right.
if Johnny has issues transitioning, did the teacher give him a prompt a few
Mm-hmm.
minutes before the did they say, hey Johnny, we're about to go outside to do X, Y, and Z. I know it's different from what we normally do, but we're gonna do it differently this time, okay? And like, did they prepare? So it could be as simple as telling a student one thing right before, so antecedents, that's where those ABCs come in. Like, are we, preparing our children? Are we preparing them to be successful in these daily school activities? So a lot of, and this is what I tell a lot of parents too, like once a behavior is happening already, that, we just have to wait till they de-escalate most of the time,
Right.
but a lot of good stuff could happen right before, you guys. We could prevent a lot of, behaviors, before.
Mm-hmm.
So before they're happening. That's why it's important to know those ABCs, the antecedent, like what usually triggers them when I say no, when I transition, when I take away. We could add those antecedents, those preventative strategies, and then they could feel more supported, right? In those different scenarios. But
Right. And some other pieces of the IEP that I want to remind parents about when you have a child with behaviors that you should pay close attention to. Goals. If the school is telling you that your child has all these behaviors, okay, I looked at an IEP today with a parent, and the school is saying that her son has all of these behaviors, that they need to change his placement. Not one single behavior goal in the entire IEP. So no, we're not changing his placement because you haven't addressed the behaviors through goals and objectives yet. So,
I'm glad
make
you
sure,
brought that up.
yes, make sure that it's reflected in the IEP through goals, through accommodations. Some school districts, I say people, some school districts always, and I won't say always, but sometimes before they get to a behavior intervention plan or before they get to an FBA, sometimes they will put in what's called a positive behavior support plan or a support plan. And so I won't say that immediately always an FBA is needed, but what I will say is that something is always needed. So if your child's behaviors doesn't rise to the level of anything extreme, severe, suspensions, schools may want to try something, I'm going to say less invasive, but it is less work for them than an FBA. And so they will just use the information that they have collected and say, okay, well, these are the things that have worked with him over time, and put it into a formal document. And that's okay too. But if you're not seeing a change with that informal behavioral data, then you need to ask for an FBA. And an FBA is a type of evaluation, which means that you have to sign consent, just like you did for the school to test your child to receive special education services. You actually have to sign consent for an FBA. So if they're not asking you to sign consent, then they're not doing an FBA. And many parents have been fooled into thinking that they're getting an FBA when it's just someone writing down some, qualitative information about their child and then developing a plan. And like I said, there is a place for that, but if the behaviors are severe, if they're super frequent, and if they're intense, we really need to go to that FBA.
Absolutely, especially when they're removing your child from the classroom outside because they're disrupting the classroom. We really want to make sure, like, they're removing my child from the classroom. Could they have done something differently? So I see this a lot when I do visit schools and my kiddos at the schools, they remove them from class time, for interaction time, from all this. You want to make sure that they're included in classroom as much as humanly possible. So if you know what to do, we won't have those many timeouts, as they call it.
Right. And so I'm going to read this comment, but I don't want to forget. So, when we talk about those removals, those disciplinary removals, it's important for parents to know that when your child is being removed from class, that is a suspension. Whether or not they document it as such or not, it is a suspension. If your child is not being educated in their least restrictive environment at that moment, it's a suspension. And so oftentimes you'll hear people say, well, the school's doing me a favor. They're trying to be so nice and they're trying to work with me. They didn't suspend him. They just sent him home. They didn't suspend him. They just told me to come and pick him up. That's not helping your child. That is not helping your child. So be very careful about accepting this olive branch from schools to say, okay, well, we're not going to suspend him, but take him home. No, honestly, and I know parents hate it when I say this. They're like, what do you mean? Put the suspension on the record. Two reasons. One, if the suspension is on the record, they have got to do something about it. And if they didn't do anything about it, or they don't do anything about it, you can hold them accountable based on your procedural safeguards or your parent rights. Okay, so that's number one. The second one is that you want to make sure that it's on the record, just in case you have to file a state complaint. You have to File due process, it's there. Anything off the record didn't happen. 3 months from now, when they sent your baby home 10 times out of the month, they'll say, oh, really? Did that happen? Let me look at his attendance. There's nothing on the attendance and you really have no proof, okay? So you wanna make sure that those things are documented. Another red flag that behavior plan is not working could be a decline in your child's performance, not just their behavioral performance, but their academic performance as well. So we want to make sure that we're watching how they're performing academically, especially for high functioning kids. What normally goes first is that academics, especially for those that are really good at masking some of those behaviors. So we want to make sure that we are looking at those academics as well. And Sharita said, what's so frustrating to me is that a lot of teachers, especially the assistants, do not realize that the speech therapist, OT, and other support staff are there to support them in the classroom. And you're 100% right. I'm going to say something too. Like, people don't realize how valuable occupational therapy is, especially for babies that have sensory concerns, sensory issues, sensory deficits. I can't tell you how many times I have seen kids with sensory issues that have never had an OT evaluation that looked at sensory. OT is not just for fine motor skills and holding a pencil and cutting. They're way more than that, and they support kids on the spectrum from a sensory perspective in a huge way. And especially for those that are having behaviors, those are the people that's going to get your child those fidgets. Those are the ones that's going to get those bands on their chairs if they can't sit still, or the little squishy things that they sit in when they say, okay, well, the child won't sit still. Okay, well, what are you giving him to help support him? Because obviously he's feeling something inside. He can't sit still. So what are you giving him? Something. The OT can help with that. And then the other thing that I want to say, and then I want you to chime in, Melissa, is the speech therapist. The speech therapist is the gateway to communication. And a lot of these behaviors are happening, just like Melissa said earlier, because there is a failure to be able to communicate their wants and needs. And then I'm going to be quiet because I've been talking a lot.
You're 100% right. So the speech, and that's, and I'm not a speech pathologist, but definitely ask if your child is not communicating appropriately, ask what is going on with the speech therapy, is the speech therapist really communicating with the teachers? Are they communicating with you guys, parents, on what, like, I know you talk about homework a lot, Dannette. Is the speech therapist giving you homework on things that you could do in the home to help your kiddo? Because yeah, there are different environments, but skills generalize, right? So if they're learning in the home, they're going to learn in the school. If they're learning in the school, they're going to learn in the home. So we want to make sure that we generalize. So if you're teaching your kid the same thing that the speech therapist was, he or she is going to learn it so much faster. But if we just keep it in one environment, we don't cross it over, we're going to be able to see, we're going to see that, we're going to notice that, right? So
Right. Yeah. Let's talk a little bit about why early behavior support translates into better outcomes.
Perfect. This one is so important, and I see it in the data. I just see it in the data because I work with all ages, and I have to say, the sooner the better, you guys, because when I work with the little ones, their progress is so much faster, and it's so much more noticeable. When we let a behavior go for so long, it solidifies. So it becomes stronger. Just like as adults, the longer we wait to change a habit, right? That's all it is. It's a habit. It's going to be a lot harder. So if there's something that you guys aren't feeling comfortable with, like, I really want to make sure my child feels supported, I want to learn, I want to do this, I want to change things up, I would recommend doing it as quickly as possible, for yourselves, for your child, and like I said, in the school environment as well, because the data shows, and children are very malleable, and as we age, unfortunately, we get more rigid, and that's for kids too, from 2 to 7, they're learning super, once I see 8, and they still learn, of course, but we need to do it more often and more, intense. So I definitely think early intervention is the way to go about it. So if you guys have a little one that needs some type of support, and this isn't the day to talk about it, but a lot of parents shy away from getting a diagnosis or from
Mhm.
talking about it because they're just, but there's no shame in that. There is no shame in that. And it's just like you said in previous posts, like it's resources, it's helping. So we need to remove that ourselves from the equation. Like, what does my child need? Let's work on what my child is needing right here. So those are hard things that's a hard pill to swallow, but sometimes we need to, give them everything that they possibly need as early as possible. Okay, you guys. So it shows in the data, it's
Yeah, yeah. And the one thing that I want to mention is, you know, when you don't intervene early with behavior, you really limit your child's future options. Because what one can deal with when your child is 5, you know, when they're 15, or better yet, when they're 25 or 35, it's unmanageable. You can't deal with those things then. And so that's one thing that I want parents to know, that you have got to be vigilant about this behavior piece. You can't be like, oh, well, they're little. No, 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 no. You've got to try to nip those behaviors in the bud and give them the replacement behaviors to express themselves as early as possible, so that their future can be as bright as possible. Because they can't go into the workplace with those behaviors. Matter of fact, even if your child, let's just say your child has an intellectual disability and autism, and you feel like, okay, it's so severe that they're not going to work, they're going to go to a day program. Well, a day program is not going to take them either if they have very severe behaviors. So this is very important that, we we make it a priority. Matter of fact, probably a top priority as far as I'm concerned, because you can get by with a lot of things just based on being respectful, being pleasant. But when you don't have proper behavior, you can't get by with anything. So it's important that, parents are very, they are very, I can't even think of the word I want to say right now, but they're very proactive, and they're very intentional. They're very
yeah,
intentional about making sure that they work with those behaviors and get help for those behaviors, and do not ignore those behaviors. And if you're having those behaviors at home, especially, because it's one thing for your child to only be displaying those behaviors at school. If they're only displaying them at school, then we know that that's a school issue, right? There's something going on at the school. But if they're having those same behaviors at home, you've got some work to do that you just can't ignore.
yeah. And it's not about, and when I talk to parents and I coach them through certain things, it's not about being a bad parent or not. It's all it is, you guys, is just knowing how to address behaviors. It has nothing to do with being a bad parent or not. It's just, so when you're aware of how you're treating your child and what you're teaching them, sometimes it doesn't look bad. It looks like you're doing the right thing, but sometimes you're reinforcing a more harmful behavior without even knowing it. And it doesn't mean that you're, bad or good. None of that. It just means that there are evidence-based strategies that are going to help you out. And like Dannette said, replacement behaviors are so important. And we also, as parents, need to replace our behaviors first on how we teach our children. And we need to learn ways, right? But yeah.
So somebody asked, is nonverbal and autism the same? Is that the same? And so the answer to that is, well, it's never the same, but it could be a symptom. So you can have autism and be nonverbal. You can have autism and have great verbal skills. You can be nonverbal and not have autism. So I hope that answered your question. But they're not one and the same, but there are autistic individuals that are nonverbal. And of course, there's some that are completely verbal. There's some with great language skills. But autism is essentially a social communication issue. And, whenever there's a social communication issue, it can be mild, it can be moderate, it can be severe. But there is that communication issue.
Yes. When in doubt, just, talk to your doctors, get an assessment, when in doubt. So,
Yeah. Sometimes finding the help is very frustrating, especially when they are high function. Oh, yes. When they are high functioning, it can be very difficult to find the help, especially most of the time, don't look for help from the school if they're very high functioning. You're going to have to fight to get that, because a lot of times the school won't necessarily acknowledge it for what it is when they're high functioning. They will talk about, oh, they're passing all their classes and they have a 3.7 GPA. What do you mean there's a problem? There's no problem here. Well, my child doesn't have any friends. Well, my child doesn't know how to express himself to the teacher when he has an issue. So yeah, there can be issues even when you're high functioning. So your work is cut out for you. It's a lot easier when, you know, it's clear to everyone that there's a problem. But with high functioning kiddos, it can sometimes really be very hard. Yeah.
And if your child doesn't qualify for ABA referrals from your doctors or insurances, there are social skills only also authorizations. So if you reach out to your doctor and say, I want a social skills evaluation, you could also get just social skills, because a lot of kiddos that are not highly impacted, they just, you know, they need social skills, and you could just get that separate. So even if you don't get direct ABA therapy, you could get parent consult, you could take courses, and you could also get services like social skills and speech. But yes, you do have to fight for it a little bit.
Yeah. And so, ooh, Melissa, we are past our time. Do you want to share a little bit about your information that you told me about, your course that you want to offer? Yes, please
Absolutely.
do.
So my main goal and one of my practices is to educate parents. For example, don't know if ABA therapy is right for your child. I have a free course on my website. It is what is ABA therapy, because a lot of the times parents waste their time, do the assessments, and then just to find out, hey, ABA therapy is not for me or my family. So there's a free course there if you guys want to check it out. And then you'll get to know what ABA is logistically. I also have a course there on ABA introduction for those wanting to know the basic strategies that we clinicians use. And there's also a course there for your kiddos if they're barely going to kindergarten or preschool and you guys want to get them ready, because I know that transition is hard. There's also a course there. So my intention is to educate as many parents as humanly possible on all the strategies that they could use, because ultimately, us as parents, we need to be able to do it, right? And if we don't have a team supporting us, or we don't want a team to be in our home for 10, 15 hours a week, we could learn the strategies ourselves, okay? So that's what what BX Consultations is about. I also do consultations as well if you want to supplement those courses with any consultative services.
Yeah. And I also want to invite you guys. I'm doing a masterclass tomorrow. It's called Fearless Futures, Essential Strategies to Create a Life Plan for Your Neurodiverse Child. And so this class really is focused on the emotional health of parents, and then giving you the tools that you need to create a life plan. Like we were talking about before, there is a long-term effect when you cannot get behaviors under control. There's a long-term effect when your kids do not have the skills that they need to be independent. And in that class, I help you get started with creating a life plan. You can go to the link in my bio, and you'll see it. It's the only master class that I have listed there. And I would love for you guys to join me tomorrow night at 7:30 Eastern Standard Time. It'll be virtual on Zoom. It's also a place where I feel like parents have an opportunity really to be very vulnerable in a very safe space. There is no judgment in that space. And I also answer any question that you would like to have answered at the end. And so right now, I do want to open the floor to anyone that has a question. Please drop it in the chat for us. We'll stay on a couple more minutes to see if anyone has any questions that you would like answered. We'll be more than happy to answer it for you. So now's your time. No questions? Oh, you guys are doing well tonight. I think we had quite a few questions last time.
We explained everything so good, Dannette. We did our job.
Okay, well, again, I hope you guys have a good night. Oh, what's the guest IG's page? What's your Instagram, Melissa?
Oh, it's BX Consultations. That's the Instagram, BX Consultations. The website is www.bxconsultations.com. Let me see if I could put it in the chat. Sorry.
While you're putting that in the chat, someone just asked, what are signs of autism? Because I feel my son is just nonverbal. So I really try to stay away from that because, you know, you can choose any particular characteristic of autism and see it in someone. It doesn't mean they are or they are not autistic. If you feel your son has autism and you want to rule out that he's just nonverbal and that he doesn't have autism, which is very possible, my recommendation is to have an evaluation done. You can either get it done through the school if he's school age. If he's not and he's like 2 years old, or I think even 18 months now, you can go through your states. In Georgia, it's called Babies Can't Wait. I don't know what it is called in all the states, but your state has a program where they have to identify children with various disabilities early. So it's early, a part of early intervention. And you can have, you know, you go to your health department or to, even if your child goes to a daycare, the person at the daycare can tell you where you can go to get a free evaluation done. Or you can take your child to your pediatrician and say that, hey, I have some concerns and I would like to have those concerns addressed. When you go to the school, you definitely want to say, hey, I want you to rule out characteristics of autism. The school does not diagnose anything. Schools are not allowed to diagnose, but they can tell you whether or not your child has those characteristics.
I also
I hope
want to
that helps, J Boys.
Oh, sorry. I also want to mention that even if your child doesn't get an autism diagnosis, if your child has behaviors, you could get a referral to get ABA therapy, direct therapy if you need to. So you don't have to wait for an autism diagnosis. Just want to make sure. ABA therapy is for a variety of kiddos.
Okay. All right, you guys, we are so glad that you joined us to talk about autism behaviors and IEPs tonight. I hope this was helpful, and we'll see you guys soon. Have a good night.
Bye.